The word poiesis means to create, to grow. And since our founding, the team at Poiesis Medical has embraced that meaning. We are creating and bringing to market advanced urinary products that provide better patient care while reducing healthcare costs. We've grown through dedication to the principle that we can achieve better patient care through thoughtful and innovative product design. Our commitment to this philosophy has led to the Duet, an FDA-cleared, advanced indwelling urinary drainage system that represents the first significant advancement in urinary catheters in 75 years. The need for improved patient outcomes during urinary catheterization is the driving force behind the design of the Duet. Now, thanks to the work and cooperation of Professor Roger Feneley at the BioMed Center of the Bristol Urological Institute, the staff at Poiesis Medical can share our inspiration for improving urinary patient care. The following short video, created and narrated by Professor Roger Feneley, elucidates the damaging effects of using traditional, indwelling Foley-type catheters.
With the end held at the neck of the bladder, the tip and balloon of the suprapubic catheter are clearly visible. Inflammatory debris can be seen floating freely around in the urine, producing an effect rather like a snowstorm. As the bladder empties, the urothelial lining of the bladder wraps around the catheter. This view of the catheter tip shows the inflamed edematous mucosa, the biofilm on the surface of the catheter, and debris in the bladder base. Note how the mucosa is being sucked into the eye holes of the catheter, forming pseudopolyps, which can obstruct the lumen of the catheter. This arises from the negative pressure which develops in the drainage tubing from the unbroken column of urine above the urine collection bag. If the vertical height between the bladder and bag is 30 centimeters or more, the suction effect can be dramatic. Watch as the bladder empties and note how the mucosa is suddenly sucked into the eye holes. And then, on refilling, the bladder has to become quite distended before the vacuum is overcome and the mucosa is released. When a catheter repeatedly blocks, cystoscopy becomes obligatory. This 85-year-old lady underwent 3 catheter changes in 3 days. Cystoscopy revealed the tip of the catheter embedded in the wall of the bladder, with the eye holes completely obscured. The balloon is deflated, but note how its walls form folds, which can occasionally produce a cuff, obstructing the catheter removal. Gentle rotation can help its withdrawal, and this releases the blood and mucus trapped around its tip. A deep cavity is exposed where the catheter tip had penetrated, but fortunately not perforated, the posterior wall of the bladder, which can be thin in women. As the catheter is removed from the bladder through the suprapubic cystostomy, thick inflammatory mucus can be seen pouring out from the lumen of the catheter.
As a complement to the footage taken by Professor Feneley, Poiesis Medical has conducted its own pictorial and video documentation of damage caused by indwelling Foley catheters. The following are comparative photographs of healthy non-catheterized bladders and catheterized bladders. The catheterized bladders exhibit the same signs of bladder wall damage captured by Professor Feneley. Supporting the images presented here is a library of research dating back 40 years that directly ties bladder wall damage in catheter patients to the current Foley catheter design. You can find study references on our website. Finally, in contrast with the previous pictures, bladders catheterized with the unique dual balloon Duet drainage system show no signs of damage. The following footage was taken by Dr. Bruce Weta, a practicing urologist and medical advisor to Poiesis Medical. Unlike the patient in the footage taken by Professor Feneley, who was catheterized suprapubically, this patient was catheterized through the urethra. As the footage shows, the catheter tip and drainage aspiration has resulted in damage to the bladder dome and posterior wall. This damage to the mucosa lining breaks down the bladder's natural innate defenses against bacterial infection and becomes the primary site for bacterial attachment. Note, however, that as the view pans down towards the neck of the bladder, no damage is present. This area, which is in constant contact with the base balloon in traditional Foley-type catheters, exhibits no signs of damage. This is the idea behind the Duet's unique dual balloon design. The second balloon is designed to prevent damage to the bladder dome and walls, just as the balloon near the urethra in traditional Foley-type catheters prevents damage to the base of the bladder. Additionally, the Duet drainage eyes have been positioned between the two balloons, designed to prevent damage from drainage aspiration.
The self-retaining balloon catheter was introduced by Dr. Foley in 1937, and despite the high morbidity, it remains the conventional method for continuous long-term drainage of the bladder in men and women. Perhaps one day, modern science and technology will introduce a better urine collection system to help these unfortunate patients.
The call for an improved urine collection system has been answered with the Duet. The Duet's dual balloon configuration is designed to prevent the damage caused by traditional indwelling Foley-type catheters. If you would like to learn more about the Duet and Poiesis Medical, please see our website at poiesismedical.com or contact us at 561-842-7560.